Hi, I'm Kiana Rush. This is week 8 of pharmacology tutoring for Southwest College of Naturopathic Medicine. And in this video, we are going to be talking about eicosanoid drugs. So I love this image. It's from Tulane University. And what I like about it the most, it's showing where we're getting this arachidonic acid. So you see the phospholipid membrane at the top of the picture. That's where our arachidonic acid is held. And when an inflammatory stimulus is applied, phospholipase A2 is an enzyme that will release arachidonic acid. That arachidonic acid can make all of the COX enzymes and also LOX, and those are responsible for inflammation, homeostasis, basically making sure we heal and stay healthy. And one thing I want to point out is the corticosteroids here at the top, inhibiting phospholipase A2, and this drug called Montelukast here at the bottom that's inhibiting leukotrienes. It's an antagonist to leukotrienes. All right, with that little bit of background, remember arachidonic acid is coming from our phospholipid membranes because of inflammation. It's freed by phospholipase A2 into all of these products below, and there's some useful drugs that act on those products. All right, so only a few drugs to learn here for eicosanoids. The first one is Fluticasone. This is a corticosteroid. And if we scroll up, we'll see that corticosteroids inhibit phospholipase A2. So that's their mechanism of action. And because of that, they're going to make a lot less COX-1 and COX-2 downstream. So this drug can be used as asthma prophylaxis as an inhaler, and it's also used in nasal sinus congestion during seasonal allergies. A side effect of fluticasone is thrush. So that's a candida infection of the mouth and of the oral pharynx as well. White blood cells may be decreased, but there's low systemic effects. This is because the drug is taken in an inhaler, so it's getting to the site of action in the oral pharynx and the lungs where we need it to be. That side effect of thrush or candida in the mouth comes from lowering the immune response due to a corticosteroid, and it predisposes the mouth to candida. I remember Fluticasone. It sounds like flute. I used to play the flute in band. I hated it. It was so quiet. Yeah, not fun. So the asthmatic can play their flute. They take Fluticasone. Mometasone, very similar to Fluticasone. I actually can't point out any differences to you. Although you can get mometasone over the counter as Flonase, and a lot of people do that. And it still has the same side effects. So someone could be getting over-the-counter Flonase, and they could give themselves candida or thrush in their mouth. And they might not know that's going to happen, but long-term, definitely an effect. The last drug we're going to learn for eicosanoids is Montelukast. This is a leukotriene receptor antagonist. So it's blocking the leukotriene receptor, so then the body has less of a response. So why do we use Montelukast? It can be used pre-exercise to prevent bronchospasm, but it's not recommended for acute asthma attacks. So this is kind of prophylactic. You'll take it before you think you might have an asthma attack. So my mental image of Montelukast versus albuterol, I'm gonna go for a hike up a mountain. I would use Montelukast at the bottom of the mountain because I think I'm probably gonna have an asthma attack on my way up. I'm not hiking yet, but I'm gonna use Montelukast before I go up the mountain. If I was halfway up the mountain and I couldn't breathe and I didn't know what to do, but I had my albuterol inhaler, that would be a good option because I would already be having an acute asthma attack. So Montelukast before the hike, and then albuterol during the hike as you're having an asthma attack. It's a good way to remember the two. Montelukast is a leukotriene receptor antagonist. It's prophylactic, and it has some side effects such as headache, upper respiratory infection, sore throat, and anxiety. So this is also an inhaler. A few questions. Why do corticosteroids cause thrush? So you'll learn this a little bit more in quarter 2 of Pharm, but corticosteroids will lower all of the white blood cells except for neutrophils. And this decreases our available cells to have an immune response. So Candida kind of has this chance to take over when we use a corticosteroid. What is an advantage of inhaling corticosteroids versus oral dosing? You're going to have less adrenal effects and less of a chance for adrenal suppression because you're getting that drug directly to the site of action in the lungs, the upper respiratory tract when you use an inhaler, and that's good. It would be bad if we always had to take a pill for a corticosteroid, and eventually our adrenals would get suppressed, and that is not good either. Which drug is used to prevent an asthma attack? Montelukast. And I actually put a little mnemonic here. So might have an asthma attack, Montelukast. Acute asthma attack, albuterol. Remember that. And this is not really a question here to end, but it's interesting. What works better, fluticasone or memetazone? Obviously, they're very similar. Memetazone is over-the-counter, available as Flonase. But when you read this PubMed research article, you'll actually see that their efficacy is very similar. So the drugs can be used interchangeably. All right. And if you guys have any questions about eicosanoid drugs, feel free to send me an email. But otherwise, happy studying.